Hi, I'm Dr. Alan Olo Austin, the founder of TRIGENICS and the president of the TRIGENICS Institute of Myoneural Medicine. We're going to be talking here today a little bit about your Trigenist, or your Registered Trigenics Physician, your Registered Trigenics Practitioner. Today you will be experiencing a new revolutionary type of treatment referred to as TRIGENICS. Your doctor or therapist has gone through a rigorous amount of training and examination in order to become certified to practice TRIGENICS. And he is essentially, or she is essentially now a specialist in how the nervous system interacts with your body and the musculature of your body. Essentially, TRIGENICS is it's a neurological treatment system that instantly relieves pain, accelerates healing, and strengthens or lengthens muscles. Essentially, it balances how the muscles all work in your body neurologically. The way that TRIGENICS works is it combines 3 treatment techniques at the same time for a cumulative effect that's much more dramatic and stronger than you would receive by having just one treatment technique applied. Today, your Trigenist will be doing a very thorough history, asking you many questions, and then we'll be doing a very special type of examination in which he or she will be testing many of the muscles in your body to see whether or not they're working properly. With TRIGENICS, things will be done a little bit differently. As structure relates to function, your Trigenist will be looking at you from a structural perspective first to see how all of the different parts of your body interrelate with one another and how any weak links may develop in different areas of your body. TRIGENICS basically changes the way that your brain communicates with your body and with the muscles in your body. When the muscles in your body become damaged or injured or stressed, there's sensors inside them that get mixed up a little bit, and they send improper or mixed up signals to the brain. And the brain then stops sending the proper signals back to the muscles, which is its job because it's there to coordinate and control movement. But it needs that information from the muscles to work properly. And if the signals coming up from the muscles aren't working properly, the brain will either send too many signals back or not enough. If it sends too many signals, the muscle will become short. And no amount of stretching, exercise will actually lengthen it for any period of time. It'll just go back to that shortened state because that's the signals that it's receiving. If it doesn't send enough signals, the muscle will become weak and it won't work as well as it should. It won't be as strong as it should be. And that will all be detectable in the test that you're about to receive. And when that state exists, it's called neurological inhibition. And with neurological inhibition, all the strength training in the world won't bring that muscle back to the proper strength. It won't become as strong as it should be. It'll remain weak. And if that muscle remains weak, all of the other muscles in your body that do a similar motion will be called upon to do extra work. And they'll work a little bit too hard and they'll become overly stressed. And then they too will stop sending the proper signals up to your brain, and they too will become neurologically inhibited. And an entire pattern of weakness and shortness and basically muscular imbalance will begin to develop that's controlled by your nervous system. So the first thing to do, it makes sense, is to fix the neurological control, to correct the neurological imbalance that exists, and essentially that's what TRIGENICS does. It resets, much like resetting a computer, it resets the way that your brain sends the signals down to the muscles in your body. And it normalizes those signals so that they're able to function properly. And once that happens, then the joints that have been stressed also begin to work properly, and everything else can work the way it should. The other thing that TRIGENICS is able to do is it's able to restore motion in such a way that if you require any manipulation or soft tissue therapy, it will enhance the effect and will allow those types of therapies to work and to be sustainable. So today it's a very exciting day for you, I think, and because you're probably, as most people are when they come to see a trigenist, you probably have been in pain for quite some time, and you've probably seen many other types of doctors or therapists, and you've probably heard that your trigenist or your registered trigenics practitioner or physician, whether it's a chiropractor, an osteopath, a physiotherapist, a massage therapist, whatever discipline he or she holds, you've probably heard that they are specializing in this type of therapy, and that's why you're here today. And it's exciting because on the first treatment, TRIGENICS, generally speaking, for the very most part, is able to afford you some relief. So hopefully you'll fall within that 90% of patients that experience a significant reduction in pain and an improvement in their functionality. Hopefully you're going to be in that 90%. If you're not, bear with it, give it a couple of treatments, and I'm sure you'll fall within that category of people that are very happy that they chose TRIGENICS as their treatment or as their method of care. The next thing that we're going to cut now, and we're going to go to probably another room, and I'm going to lead you through your interactive participation in the TRIGENICS treatment process. There's a very specific way that you're going to have to breathe, think, and move, and while at the same time you're going to also have to interact with your doctor in a very specific way that I'm going to teach you about right now, and that will prepare you properly for the treatment that you're about to have. Thanks for listening. I'm Dr. Alan Olo Austin, and I look forward to hearing from you about your experience with TRIGENICS. Please feel free to let us know how much it's helped you by going to our website, www.trigenics.us. Thanks.